Hello, this is a presentation about a human immunodeficiency virus, or HIV, not to be confused with the later stage of AIDS. Uh, my name is Omar Ahmed, and I'll start off with a general description. If I can. All right, so HIV was a fairly new disease in our history. It started in 1981, and uh, we had to make sure that the distinction that AIDS is not its own separate thing, it's just a later stage of HIV. You see, the first stage of HIV is called an acute HIV infection, people who have a large amount of HIV in their blood and are contagious at that point. And it's similar to a flu, but again, it's just more severe as the time goes on, and that would lead to stage 2. Chronic HIV infection. The stage is sometimes called asymptomatic because sometimes the people who actually get HIV don't show any symptoms for some time because everyone's just a little different. And we have people who would eventually, even as this would progress, it would become stage 3, which is the acquired immunodeficiency syndrome. And that is the most severe stage and has a significantly high viral load, and it's even easier for it to transmit to others. And at this point, their immune system is severely damaged, and they can get even more sick from other random things that wouldn't normally get other people sick, like random sores in your mouth that would your body would naturally be able to kill that easily, or just other easily defeatable diseases or sicknesses that you would come across. So, for the signs of HIV, we have roughly about just a whole bunch of any flu symptom you really think about. So then I'll just have to read off the list because we have the fever, a swollen lymph nodes right around the neck, right below the neck line, right, and then we have weight loss, sore throat, vomiting, rashes, diarrhea, mouth ulcers, and night sweats. That's how they look, and if you have one or two mouth sores, not to be concerned. That's more severe than just one or two. But if you do think you have an issue, then we just go to treatments. You have to be uh, HIV is no longer a death sentence as it was back in the 80s and 90s and early 2000s. But in the case of exposure, we have PEPs, or post-exposure prophylaxis. These are medications that are actually capable of actually um, they're only effective in the very beginning when you around the 72-hour mark. So immediate care and knowledge of this is very key to actually being allowed to spread and stop the spread of HIV at all. PEP involves roughly, it takes about a full month and does have some side effects, so it's not going to be fun either. But it is a very, very great advancement technology that was not available in the early stages. There is no cure of HIV at the moment, and there is a vaccine in development, and we'll get later onto that. But there have been people cured of HIV, which is really interesting. There's only been about 5, and they had the unfortunate, all 5 of these people had in common is that they all had blood cancer as well, and simultaneously had uh, roughly a genetic, they had a genetic protein that allowed them to make them resistant to HIV when they were going through cancer treatments. And they were actually able to have no, uh, after they were able to test them for years later, they were able to confirm. Actually, the one in September of this year, it was actually discovered that person was in 2019, but it took years and years of of data to check if they actually were cured, and it was recently confirmed that yes, they were, because of their genetic mutation that allows them to be resistant. The treatments that are there also have been the antitrovial medicines, which are allow the stopping replication of the virus completely, and thus allowing the immune system to repair itself. But there is still the HIV there. It doesn't go away. It's such even certain celebrities uh, that are uh, in that are that are famous for having HIV no longer are able to even to transmit it because it's such a small amount of viral loads inside there. But again, we'll be going to prevention and into a later slide. And then we also have uh, this treatment of the antiretroviral medicine takes about 6 months to actually to start effectiveness. So it's not an instant cure, but people can live normal lives now. It is not a this medicine is what allowed people to not make HIV or AIDS uh, to be a complete death sentence as it was earlier in the history. So we have the causes and risk factors here. Sexual transmission is probably one of the larger spreading causes through unprotected sex. Blood-to-blood transmissions, such as sharing needles with heavy drug use, with a with a lack of proper knowledge of how HIV doesn't spread as well. Uh, but let's say there's a blood transfusion as well. They that did happen on a rare occasion, but ever since their reforms have happened that made sure that the screenings for blood transfusions that would transmit HIV will no longer ever happen again, and we can say that with confidence now. And we have mother-to-child transmission. A mother who has HIV who would later transmit it would later become uh, uh, would later have HIV as well. And of course, the idea that gay people only have HIV is a complete myth. It can spread to any person, does not care about sexual orientation, and also certain areas of the world have significantly higher amounts of HIV in the world, such as southern and eastern Africa, which have almost a little more than half of all HIV people. And again, that doesn't mean that other places in the world are less at risk. It's always good to practice and to be aware of how these diseases can spread. Prevention of HIV is, again, safe sex practices have a barrier. There is no other way to prevent this. Also, to have needle exchange programs to make sure that the people who are using drugs can have a place to actually have a place where they can get new needles instead of sharing them with other people. And of course, the post-exposure prophylaxis that we mentioned earlier, how it can prevent an HIV transmission. And of course, the stigmatization of HIV because people sometimes are afraid to seek out care and they are embarrassed to actually admit that they have it because of the stigma behind it. And of course, the intertrivial therapy that I mentioned earlier too. And again, the most ultimate effective tool against to prevent all of this from happening in the first place would be uh, just to understand how it actually spreads. For testing and diagnosis, there's really just these four main paths. Rapid point of care, that's at a doctor. They give you take a blood sample, and then they actually do the 20 minutes. It takes about 20 minutes. And then at home, same thing. It's just, but you need a blood sample, put it into a tube, into something similar to what we are now used to, a COVID test for a rapid test, similar to that. Nucleic acid tests and the standard point of care are very similar in the way they work, except nucleic acid, of course, just measures the HIV RNA, and the standard point of care is just at a doctor's office, and it takes a longer time. And usually, this is how they always do it. Standard point of care. I actually had to go through this once when I actually pricked myself with a needle when I was injecting a patient by accident, and I had to go through all of this myself to make sure I didn't do anything, and I was fine, luckily. and the person didn't have HIV. But again, just the idea of this culture of being aware of making sure that you cannot get anything is a good idea. Cell microbiology of HIV. HIV is a retrovirus and consists of RNA. It does not have DNA because it is a virus, so it's not technically alive. So the enzymes that carry it are reverse transcription, and this converts the RNA to the DNA when it occurs. And then we have that in this little area that we can see here. We can see the integrase the reverse transcriptase right there, and then we have these buds here that allow us to I'm sorry, the docking mechanisms that allow it to attach to the white blood cells, and they are allowed to bind their the CD4 molecules in the surface of the helper T cells and replicates with them. And then we have the HIV life cycle, attachment, and entry. The virus attaches to the host cell, that we can see right here, via the CD4 receptor and the co-receptor, the CCR5. Uh, and then we have the reverse transcription. The viral RNA is transcribed at the DNA that we see over here. And then we have the integration. The viral DNA is integrated into the host's genome, forming a provirus. So we have that right over here as well. And then we have the description and translation and transcription. The host cell's inner machinery allows it to start producing a new viral RNA and proteins, and thus it starts to build and assemble the HIV that we see right here. Then we have some of the more recent information that how HIV actually influenced the development of COVID vaccine. The mRNA technology was the reason we had the COVID vaccine in the first place at such a fast and rapid speed, because we have been developing this technology for close to 30 years before this. It isn't just 1 year and done. No, this was decades and decades of work, of hard work of scientists that were able to save millions and millions of lives. And of course, the nature of HIV doesn't allow you to have a healthy white blood cell survive after uh, the instance of actually surviving this, because that's what it targets. And again, it, the COVID vaccine, of course, uses uh, the crucial mRNA information to start to collect the data that we need just to actually kill the COVID-19, rather than actually having to wait for a host to survive and to allow the collecting harvesting of white blood cells after that. So with that information, it allows us to skip a lot of time and save a lot more lives in the process too. So, and then this is the end as my reference section. Uh, of course, HIV in 2022 has been decreasing for many years. It's actually gone down about 38% in decline since 2010 and 59% since the peak in 1995. And with this rate of information of informing everyone, we will be allowed to actually end, I believe in our lifetime, we should be able to end HIV completely and eradicate this horrible, horrible disease that's killed so many innocents. And the future is looking bright. Thank you again, and I hope you enjoyed this presentation.